It's Dr Rick back again with another update regarding our COVID-19 vaccination programme. So today, I'd like to talk about clots. There seems to be an awful lot of discussion around the Astra-Zeneca vaccine and whether or not it's connected to blood clots. Blood clots in human beings are not uncommon. As GPs or hospital doctors, we're fully aware that people, as they become more unfit and as they gain weight and become more elderly, are more at risk of developing a clot. And clots form in deep veins in your body, normally in your legs, and sometimes they can break off and then unfortunately move across your body and sometimes stick in your lungs. Sounds horrible, and it is. Most of the time, clots cause swelling in your legs, can cause chest pain and also make you breathless. And they're definitely something to avoid, because in a small number of people, they can be so serious as to threaten your life. So when people report either having a clot in their lungs or their legs straight after having a COVID vaccination, this is taken really seriously. Some very important people in the NHS, such as Public Health England and the Medicines and Health Regulatory Authority, are taking this discussion very, very seriously. And they've done some research to compare the rate of having clots in people who have been vaccinated with COVID compared to people who have not. And they've found no difference. So out of the 17 million people vaccinated across the EU and the UK with the Astra-Zeneca vaccine, there has been so far 15 reported cases of DVTs and 22 clots in the lung. And there is no one group of people or age of person who gets these clots more than anybody else. So we are talking 37 cases of blood clots in 17 million people. And this is found to be actually lower than what you would expect in the population being immunised. So the public health people are really certain that there is absolutely no association between the AstraZeneca vaccine and blood clots. This appears to be one more unfounded COVID vaccine scare amongst many. So I myself and the local leaders in health and social care across Tameside and Glossop are recommending that people accept the AstraZeneca vaccine when offered to them. Every regulatory authority states in the UK that the AstraZeneca vaccine is not associated with blood clots. So please help us put this rumour to bed. As a local GP, I'm so worried about vulnerable people who may get a serious COVID infection not being immunised because of this scare.